This is Bean, the therapy cat. She's helping me film the video today. Say hi, Bean. Off you go. So today we're talking about the introduction to the knee. Like the shoulder, most knee problems actually share a common origin. So we're talking about patellofemoral pain, we're talking about knee arthritis, we're talking about meniscus tears, we're even talking about a lot of ACL tears. They tend to start the same way, and depending on the acuteness or the violence of what happens to the knee, they all kind of progress differently from there. So first of all, let's talk about how the knee is put together and what usually goes wrong with the knee. So in the knee, you have the thigh bone that comes down like this, and it meets the shin bone, the lower leg bone. This is the femur, this is the tibia, and they meet together in the knee. The thigh bone splits into two bumps called condyles, and those condyles sit inside the meniscus. The meniscus is this blue thing. It's a fibrocartilage pad that's kind of cup shaped like this, and it holds the end of the femur so that as the knee bends this way, it doesn't slide forwards and backwards too much. So what happens when you have problems with the knee, generally speaking, is that the knee gets unstable, and this happens every time you bend the knee. When my knee is straight, these ligaments, the MCL and the LCL on the outside, hold the knee tight. You can see there's not a lot of motion there. But as I bend my knee, you can see these ligaments develop slack in them. And now there's a lot of motion that can happen in that knee because these ligaments are no longer tight. When the ligaments get loose, I can do one of two things. I can either use the muscles in my hip, which I have for this specific reason, and the muscles in my ankle to hold the knee stable so that it bends straight and it doesn't shift from side to side, or I can allow my knee to twist. So you see, if I bend my knee this way and then I allow it to twist to the inside, see how those ligaments get tight again? So now my knee is stable again. The problem is that I'm grinding on the knee and I'm creating lots of problems with the knee because of that position. So if I bend my knee straight, I have a nice straight hinging motion on this meniscus. If I bend my knee and allow that inside twist, you can see what's happening is I'm grinding on those menisci every time I twist, so they wear out faster. So you have meniscus tears, you have osteoarthritis happening because of that twisting motion. Patellofemoral pain is this pain in the front of your knee around the kneecap. So if I bend my knee straight, my kneecap rides inside of this groove on the femur where it belongs, like this. If I allow my knee to twist, what happens is I bend my knee, and then to keep it stable, I twist it this way. So now you can see what's happening as I bend that knee up and down is that kneecap is riding way to the outside there. It's not riding inside that groove like this where it's supposed to. It's riding on the outside like this. That creates pain where it grinds with the extra pressure on the outside of the knee. It also creates pain on the inside of the knee where you're overstretching things like your medial retinaculum that's supposed to hold the knee over like this, but as you pull this way, you're overstretching it. So that's where that pain comes from. It also leads to ACL tears because when you're bending the knee this way and then allowing it to twist, what's happening is I'm putting extra twisting force on that ACL, and it's more stressed. Your classic ACL tear happens because the mechanism of injury happens when you plant the foot, you twist on it, and then some unexpected force impacts your knee. So if I've bent my knee, I've twisted it and wound up that ACL, and then anything unexpected happens, I'm putting maximum force on there and it just tends to blow. So that's how all those knee injuries are related. So how can you tell if this is your problem? First is to check your knee alignment, right? So the first test I always have people do in the clinic is to put your feet together, put your knees apart, right? This is easy for everybody. You can see that your legs move this way. And then try to stand up and see if you can maintain your knees apart. So if you're standing up and you try to put your toes together and you find that your knees are hitting each other first before your feet get together, this is a serious problem. I have people a lot of times make the excuse of, oh, well, my legs are fat, or I just can't do that, my brain doesn't work that way, or what about Q angle? Don't people have a Q angle sometimes as a problem? Those things are all possible, but not really, right? Your legs are not too fat to be able to do that, right? I can have a foot between each leg. You know, most people are not going to ever have that problem. just can't do that. Well, if you can sit like this and you can put your knees apart, then you can do it. It's just that your muscles aren't working in the way that will allow you to do it when you're standing, and they need to. The myth about Q angle, there's a lot of fact and there's a lot of myth about Q angle. Q angle is typically larger in women, but it's not for the reason that people think. The real reasons that women tend to have larger Q angles are 1, cultural, and 2, physiological. Cultural reason is that women wear short skirts, right? And if I'm wearing a short skirt, I kind of have to keep my knees together and get into this bad position when I'm sitting. Physiological reason, women just tend to have a little bit weaker hip muscles than men. It's just a statistical reality. So that's why, that's the real reason why this tends to be more common and why women have what we think of as a Q angle, which is really just standing with your knee bent sideways. It's not supposed to bend that way. So how do you start fixing this problem? So the first thing to be aware of is that as you're moving your knee should always stay aligned with your foot or even a little to the outside of your foot. So as I perform whatever motion I'm performing, whether that be a lunge, whether that be sitting up and standing from my chair, whether that be a jump shot or a lateral cut or any motion that I might want to do, my knee should not be falling to the inside. As I do my lunge, my knee shouldn't go in here, it should stay out here. And that's over an aligned foot that's going straight. Understanding that is the first problem. Being able to fix it is a twofold issue. So we hear a lot of therapists talk about, oh, knee problems, you have to fix your knee problems by strengthening the ankle and strengthening the hip. Yes, you do need enough strength in those muscles in order to maintain the position that your knee is supposed to have, but there's a second factor that's even more important. The second factor that's even more important is that you have to retrain the way your brain activates those muscles. So I can have all the strength in the world to pull my leg out to the side, but if I can't figure out how to use that muscle to fix where my knee goes, then I'll never get better because I'll still be bending my knee the wrong way. So if you tried the test that I just showed you and you found that it was difficult, usually the biggest problem for that is that your brain just doesn't know which way to move your knee. So retraining the brain, retraining each movement that you make in order to put the knee in the right place to be successful is the second and more important part of physical therapy for the knee that often gets overlooked. So next steps from here, check out the exercise videos. I will be posting those soon in order to help you learn to use the muscles around the knee and in the leg to fix that problem. Also, because different people have different weakness patterns, different muscle groups, and different activities they want to do, you will need some individualized attention from a therapist in order to help you correct knee motions through each activity or sport that you want to get better at. That's the video for the knee today. I hope that you have a better understanding of physical therapy.